You were just,
Start my recording. All right. I'm Coach Fred, and I got Coach Bill on there, and this is where he normally does a disclaimer, but he says he forgot what it's supposed to say. But basically, we're not doctors, and what we're talking about here is just different habits of health. And what we do each week is to learn about something about health, because I feel that knowledge is power. The more you know about the human body and what you can eat and what you can't eat, that you have a better chance of having health in your life. So today we're going to talk about diabetes, cancer, and the pancreas, and what the pancreas has to do with that. And it's pretty interesting. Of course, everybody knows that 2/3, well, not 70% or better of the country making this left-hand turn down here, and that ambulance is lurking back there behind. But we're trying to help people learn to make better decisions so they can be healthy. Now, this is our favorite doctor, Dr. Eric Berg, and he's going to talk about diabetes, cancer, and the pancreas.
Let's talk about what caused your diabetes, okay? If you have diabetes, this video is for you, and it's a very important video for you to understand how you got there, okay? First thing I want to talk about is normal blood sugar. A person who is healthy should normally have about 80 milligrams per deciliter of sugar in their blood. And what does this mean? It means that you basically have about 1 teaspoon of sugar in your blood. That's not that much. An average American consumes 31 teaspoons of sugar. But why do they have normal blood sugars? I mean, it doesn't make sense. You would think that this blood sugar would go up immediately, right? Well, it doesn't, because of this one thing. And the hormone is called insulin. Anything more than 1 teaspoon out of the blood, and it hides it in other places in the body. It's basically a storage hormone. But what's ironic is that the blood sugars are tested, but insulin is rarely tested. If they were to test the average American, they would find this screaming high. Why? Because an average person consumes 31 teaspoons per day of sugar. In order to deal with all that excess, this hormone is just working overtime 24/7. What does this hormone do with this sugar? Well, it has to put it somewhere. So what it does is it converts it first to the fat cell. Then it starts putting it into what's called the subcutaneous fat, which is the superficial layer of fat just beneath your skin. Okay, so there's quite a bit of surface area for your body to store fat in that way. So that goes on for a period of time. Then what happens, you start developing what's called ectopic fat. And ectopic fat is the fat outside the fat cell, okay? It's outside the subcutaneous fat. And your body was never designed for this to happen, okay? Because we're talking about fat being now stored in the liver, and then in the muscles, and then in the heart. It's very similar to a hoarder. At first, this person is storing stuff in different cabinetry, okay? But over time, things start building up in the kitchen, in the living room, in the bathroom, until there's no place to live or exist. Their spacing is becoming less and less and less until finally they cannot even open the refrigerator, and you start developing rats and all sorts of problems, and they get very, very sick. But guess what? If you're consuming this much sugar, the insulin hormone has now become a hoarder. And not only is it going to start to pack up the liver with fat and the muscle and the heart, but it eventually spills over into the pancreas. When this happens, as another protective mechanism, you're developing insulin resistance as well. But here's the big point I want to make. You won't really develop diabetes until the pancreas starts filling up with fat. It's not that the cells of the pancreas that make insulin are burning out. The pancreas is being clogged up with fat, and that is what's creating the dysfunction causing the diabetes. Diabetes is a state where the blood sugars start to go too high. It's out of control blood sugars. Why? Because you lose the insulin function. Why? Because your pancreas is clogged up. But this is the entire cascade of things that happen if you continue to eat too much sugar and insulin is too high. Your doctor would have picked it up if they would have done a fasting insulin test or a test called HOMA-IR, which is another test to measure both fasting insulin and your glucose to measure insulin resistance. Well, that's very interesting, but now what do you do about it? The cool thing is this: if you have diabetes type 2, your pancreatic cells are not burnt out. They can be reversed. They can come back. How? If you remove the fat from the pancreas. How do you do that? You go on a healthy keto plan, you start doing intermittent fasting, and as that fat starts to come off these organs, the cells start to reverse and you no longer have diabetes. If you're new to my channel and you would like to know what to eat to start taking the fat off the pancreas, as well as the fat of the liver, I put that video right here. Check it out.
Okay. What we know from our studies here is that chronic hyperglycemia leads to all those things that on the dominoes that I have. We have kidney disease, type 2 diabetes, nerve damage, cardiovascular disease, eye damage, leg and foot damage, and I've had relatives on my wife's side that have had limbs removed because of diabetes, and become susceptible to infections. Well, like even coronavirus 19, they're more susceptible to it if a person has a weakened immune system because of all these different things. And it's also a person that has a fatty pancreas is more likely to has a better chance of getting cancer than others. So it's, that's kind of where pancreatic cancer goes. And when you get that, it's practically a death sentence. It really is. Now, what foods level blood sugars? And that's, of course, the low glycemic foods. We have a color-coded system that Dr. A has developed, and as long as you're eating the low glycemic, less than 55, that slowly increases the blood sugar levels that foods do. And the higher you go up, the more rapidly the blood sugar levels go up. And that causes the inflammation, that causes the insulin pump to overwork, and that's kind of how it works. So you want to use foods that are really low on the glycemic index. And it goes back to this little scale here. The choices you make on a daily basis kind of determines where you'll be in the future. If you're making good choices, chances of you getting to having better health is much better than if you're having cheeseburgers and fries and malts every day, where you end up down here. So that's kind of where that goes. So if you follow the habits of health and do what you know to do, work with your health coach, then you can win that half marathon or whatever. And then one thing about it, you'll never change your life until you change something you do daily. The secret of your success is found in your daily routine. And we know this to be true. Do it on a daily basis, and you're retraining your brain. Now I've got some pictures of wanted to show you that I took with my drone. This is the Santa Fe Trail marker. It's up north about 20 miles of Hutchinson. And Daughters of the American Revolution put these out all over. This is 1906 is when they put this out. Now this is up on top of the hill. right there at that point. And this is taken with my drone. This is from about 400 feet up, and you can see the trails, the tracks going through there. And they kind of keeps the grass off of it so that you can see them a little easier, because once the grass covers them up, they're kind of hard to see. Now I have a picture here. This little marker right here is where the Santa Fe Trail actually crossed this road. This road is P Avenue, and it's north on Plum Street, probably about 20 miles or so. This river right here is the Little Arkansas River, and somewhere there's a creek coming in from this other direction. So the Santa Fe Trail probably crossed either here or both. There's two different places that they crossed, and then they come back together just before they get to the hilltop where I showed you the picture. This is a marker at the Santa Fe Trail ruts. This is called Fry's Ruts. And this is right at where the river crosses. They used to have a Camp Grierson, and they had a dugout right next to the, right in the where the river comes through. And as much as we know that the Little Arkansas floods, I bet they had to move out of there a time or two. What do you think?
Yeah.
And, in 1885, there's a group there. They call it Station Little Arkansas. That's where, and they used to have a trading post there. And there's quite an interesting story about the people that run the trading post, and they used to trade with the Indians and take care of buffalo hunters that were after the hides and that type of thing. Then in 1867, they had another group there, and these were the Buffalo Soldiers. And that was called Camp Grierson at the time. Buffalo Soldiers were African American soldiers, and the Indians called them Buffalo Soldiers because their hair was short and kinkly and curly like buffaloes. But it was actually quite an honor to have that name, and they were really good fighters. Now this is looking toward the southwest. I'm kind of up over that field that we were looking at a while ago, and you can see this right here is what we could see very plainly, but you can still see over towards the southwest where the trail used to go. Now, when you're on ground level, you can't see that. This is the car, and there's that Conestoga wagon and the oxen.
Fascinating.
Now,
It is very interesting.
thank you. Now, this is at almost at ground level, probably about 10 foot high. You can see how deep the ruts are. You can't tell that from way up high, but they're really, really pronounced. And I was really quite impressed with this place. It's not that far to go see.